So welcome to this introduction to the TTP, the ThermoTraumaPort, and we're going to talk our way through how we would actually get the patient from the roadside or from the scene of the incident onto the stretcher in as comfortable, easy and quick way as possible. So the TTP would come presented in the bag, and it may well be that at the start of an air ambulance shift or an ambulance shift the TTP could be prepared on the trolley all ready to go. But we would take the TTP out of its bag, and in the front of the bag as well there are the straps for the patient and also the rechargeable battery, the standard military battery. Inside we have 4 poles, so two for each side. So we just move the bag out of the way there. Now you could at this stage place a rock snake or blizzard blanket on top of the stretcher, and certainly on board the aircraft we would have this prepared with some of our kit on the top of that as well, ready that the patient would be able to be just lifted straight onto that with the rock snake wrapped around. We're now just going to slide the cover onto the TTP, again puts in nice and easily all the way to the top, and then we can seal the Velcro at the bottom. So fold the stretcher out, making sure that you have the stretcher the right way around, and it's fairly important to just try to straighten out some of the creases, particularly the edges, which make it easier to slide the poles in. And we're then going to, on either side, just insert the pole up the outer sleeve and slide it all the way up until it hits the top of the sleeving. So we take the battery out of the bag, we check the charging status on these 2 levels here, and once these are fully charged we should expect that we will see around about 5 hours of use out of the device. So we open up the outer cover, we release the cover over the battery compartment and just flip out the cable there. The battery simply slots into the base of the unit and the connector plugs straight in. I'm going to just tuck that away to make sure it's protected and that's then not going to fall out. The control panel down here, there is the switch, and as I press this you'll see the blue light come on and the green light to confirm that the device is in use. No other warnings indicated there, so this will now take just a few minutes for the pads to reach around about 36 degrees Celsius. I'm going to cover those away with the Velcro, and the device is there essentially ready for use. So we've now placed our patient onto a scoop stretcher in the usual way, and if we were going to be taking spinal precautions we could at this stage use all the straps. Actually we're not doing a huge amount of movement and we've prepared the stretcher right next to the patient. So for the purpose of this demonstration we're just going to lift the patient straight over and onto the trolley. Ready, set, lift. So at the roadside the patient is now on the device that they can now stay on for the rest of the journey through the pre-hospital phase in the transport, but also onto the CT scanner, into the emergency department, or even all the way up to theatres or the intensive care unit. Once the patient is on the trolley we will release the scoop gently. And then as needed we could use head blocks, either the sticking directly onto the scoop onto the device itself, and we can use straps to secure the patient. So once the patient is prepared on the TTP we can now use any of the device handle holes to pass the straps through in the way that would be useful for the local organisation. For this case we're going to just place a figure of 8 around the top. These straps being long enough that they can accommodate a variety of different patients in different positions as well. And as the straps are tightened up, it just brings the TTP into a nice gutter shaped position to be able to secure that patient, to make them even more comfortable. So as you can see, there's actually there are several holes down each side of the TTP, which are able to hold the patient nice and firmly. The straps are very long, so if you wish to go across as a rectangle, if you wish to go around the ankles in this fashion, or maybe just use the strap straight across, there is a lot of flexibility, and certainly in terms of immobility, the patient is now immobilised, is nice and comfortable, and the device will have reached its operating temperature. So the patient, who is often in this case skinned to what would otherwise be a very cold scoop stretcher, is now on a nicely padded, warm device which will keep them comfortable and pressure sore free during their subsequent transport and early management. So once we've arrived at the emergency department, it's a simple matter to just bring the trolley alongside the ED resus trolley, or alternatively directly to the CT scan bed, or even up to the ICU or OR. And all we need to do then is simply ready, brace and slide. Once the patient has reached the place that they're going to be having most of their clinical management, very easy matter to just remove the straps. Again, with full spinal proportions as required. Much easier to take these off than a lot of the original clip type straps. Out of the way very quickly. We will then bring the bed alongside and slide the patient off of the device. Once the patient is off the TTP, we've finished with its use. Open up the lower end and we can switch off the device, unplug the battery and simply use the two cutouts to free it up. This can go back to its charger, ready for its next use. We'll leave this end open, and of course we'll take the holes out of each side. We can roll away the clips back into the bag again, giving those a wipe down with some Clinell wipes. The single-use top, we can make sure that there's no obvious external damage. Otherwise we can just very easily slide the TTP out, make sure again no tears, fold it up. As required, once we've removed the cover, we identify any contamination or damage, we can wipe those down with a simple Clinell wipe, and also use that to clean the straps ready for storage and ready for next use.